Hey everyone, this is Dr. Brenda Heinecke with Revitalize Physical Therapy. So thanks for watching. Give me a little thumbs up if you can hear me okay. This is our first Facebook Live workshop we're doing, so bear with us if we run into any issues. But really quick, so like I said, Revitalize Physical Therapy, what we do is specialize in helping women live healthy, active lives. So we are pelvic floor women's health specialists, and so we treat kind of a pretty long list of issues that women typically deal with, such as incontinence, diastasis recti, like we're going to talk about today, painful intercourse, and back pain are kind of some of our big ones. So we have offices in both Wauwatosa and Hales Corners, so we're pretty conveniently located for most. But really quick too, before we jump into everything, if you all of a sudden can't hear me, let me know, comment on there. If you have questions, feel free, put them on there. We've got Lauren, our PT student, with us, and Bethany here kind of fielding questions if we need to. So feel free to comment and we will try our best to get to them. Also, if you have not already downloaded your free worksheet for today, you can click the link that's on the video description to download your worksheet. If you download that worksheet, we're also going to be sending out some bonus materials after this to those that have downloaded that worksheet. So if you haven't done it yet, please do that, and then you can follow along. Otherwise, make sure you do that after. Okay, so I'm super excited because we are going to talk about diastasis recti today, which is a pretty common issue for a lot of women. And what it is a separation of the abdominal muscles right down the midline. It's common during pregnancy. So they say that about 60% of women will have diastasis recti during pregnancy, and then 40% still have it even a year after. So pretty big numbers. I've actually seen other statistics that rate that a little bit higher. So what we're going to talk about today, we're going to talk a little bit more about what it is, how to know if you've got it, and then what are some things that you can do to help alleviate that or prevent it if you're worried about it. Most commonly, women might notice kind of a doming, like this little bump coming up in their abdomen, maybe around belly button, but it could span anywhere from your sternum on your rib cage all the way down to your pubic bone. So anywhere in that space, you could have a little bit of a bulge, doming. Sometimes women report feeling really unstable or almost like they feel like their insides are going to fall out. So that's another common complaint we hear. Another thing that we see often is instead of it doming up or creating a bulge, sometimes it could actually almost be indented. So potentially you might notice that when you contract your core, you might have this like it might sink in a little around your belly button and you can see this little hole essentially. That's also common. And then lastly, another common complaint with women that have this, especially after baby, they feel like they have kind of like the mommy pooch, if you will, that no matter what they do, they just can't seem to get the core to kind of flatten out and slim down. A lot of times it's because they have this separation and the muscles aren't working well, and so you kind of get stuck with this little pooch, or as one of our patients calls it, the mommy box. So what really is a diastasis recti? So as I mentioned, you have the separation down midline. So to kind of show you, I'm going to use my water bottle here. Think of your trunk as your water bottle. So your diaphragm is on the top, your pelvic floor is on the bottom, and then you have all of your abdominal muscles in the front, your back muscles on the back. What happens, your trunk, it's kind of this finite space. So when you have increased pressure, sometimes you can have too much pressure building up inside of your water bottle, and that pressure has to go somewhere. So with the diastasis recti, that pressure pushes forward, it comes out, and those muscles separate. Other issues like prolapse or incontinence, that pressure is pushing down, and so you have issues with pelvic floor. Heartburn is another example where pressure is pushing up and it's just too much pressure inside of the water bottle. So on the front, on the ab muscles, you have 4 layers of ab muscles. The most superficial is called the rectus abdominis. It's like your 6-pack ab muscles. So that kind of runs straight down the middle of your belly. Then you have your external and internal obliques on the sides. And then your last deepest layer is called your transverse abdominis. And what it does is wrap all the way around like a corset and hooks onto the pelvis, hooks onto your rib cage, and hooks onto your spine. So that muscle, when it contracts, basically cinches everything in like a corset would do. It also is really pretty much the main stabilizer of your trunk, because it attaches on all these areas. So it's attached on the pelvis, it's attached on the back, and it also kind of hooks up into the diaphragm. So it's kind of covering all these areas. When you have this separation happening, you kind of lose a layer of support and stability. And so it's really important that the deeper layers underneath are strong and doing their job properly, so that you're stable in the trunk, and you can do movements without issues. Because going back into the rectus, so the rectus abdominis, your 6-pack ab muscles, those are the muscles that are kind of splitting apart with the diastasis recti. So what happens is you have 2 muscles and they're connected with connective tissue or fascia right down the middle, and it's that fascia that starts to separate. So it's not necessarily, or I should say, it's not the muscles actually like ripping apart, it's the fascia in between that is separating and they're pulling apart. But this connection, this fascial connection, it hooks onto pubic bone, hooks all the way up into the rib cage. So that's why when you change certain positions, it can affect this separation, this diastasis, because of how it hooks up. The fascia then also kind of wraps all the way around the muscles. It runs up and down through the abdomen. So one of the things that I always look at with patients coming into the office with this issue is that the fascia might not be moving very well. And then if that's the case and it's stuck, like things aren't gliding, it can pull on that separation even more. So some of the structures that affect diastasis the most, it's really your abdominal muscles, your back muscles, your pelvic floor, and your diaphragm. So those 4 muscles. Then you have the fascia here that's kind of joining all these muscles together and joining them, with layers, kind of stacking them. And then lastly, you have your posture and your pelvic alignment. So if you're slouching really bad like this, what happens is you have all this pressure that happens inside of your trunk because you're slouching. So when you slouch, that pressure has to go somewhere. So typically, women that might have bad posture might have a worse diastasis or be more at risk for it because that pressure is pushing out. So looking at pelvic alignment and posture is also a big thing for diastasis, so that we can kind of basically even out that pressure and normalize it so you can do movements without adding more stress to the structures here. Makes sense, everyone? Questions on that? If you do, or give me a thumbs up if that makes sense, or a little preach. Yeah, wow. Okay, so now that we kind of went over basically what's all part of diastasis, how is it all awesome? We got some thumbs up. You know, what's all really connected there. I always say, you know, it's everything on this water bottle. A lot of people, they want to just work on core muscles. And how many of you have, you know, after baby and you're just doing ab muscle, ab muscle, ab muscle type of exercises? You're just working really hard to try to get these abs back because baby stretched everything out. So the problem is all those other structures are a big factor. And so that's why kind of everything needs to be addressed in order to have the best success. I should also mention too that when you have a diastasis, it's once things separate, you might not always come all the way back together. So sometimes that separation is still going to stay to some degree. It might lessen, but it's unlikely that it's going to come all the way back together and join. And that's not really the goal. But just to kind of throw that out there, a lot of people think that you're closing this gap and bringing it together. So what causes this? Really, the answer is they don't know. They don't know why some women get it and some don't. A lot of it really comes down to the pressure that you've got going on inside of your trunk. So some things put you at higher risk for it. So you can actually get a diastasis recti when you're not pregnant. Some of the bodybuilders will get this because there's so much tension on the muscles that it'll actually start separating. So it's not just a pregnancy thing. It can happen to anybody, but pregnancy is one of the most, or I should say, biggest risk factors for diastasis. So not just pregnancy in general, but then multiple pregnancies. So the more pregnancies you have, the higher your risk gets with each one. Also, carrying multiples can be another risk factor. So if you have twins or triplets or even more, which if you do, I don't know how you guys do it, but that all puts you at higher risk because everything is expanding more than if you had just one baby there. So multiple pregnancies or carrying multiples. Also, how much time you have between pregnancies. So if you are having kids back to back to back, it's less time for everything to heal up. And things might not be all the way back where they should be before you get pregnant again. So it just keeps kind of stressing these structures that maybe aren't totally healed up or back to normal, if you will. Also, having bigger babies can put you at higher risk, similar to having multiples. The bigger the baby, most likely, you know, maybe bigger the belly. That's not always the case, but it can be a higher risk factor because there's more weight, there's more pressure inside that can strain that diastasis area. Another big cause of diastasis is if you have any kind of history of constipation. So we know that constipation is really common in pregnancy. Many of you may have dealt with these issues during pregnancy, even after pregnancy, postpartum. It's fairly common. But when you're constipated, if you're always straining to have to go to the bathroom, you're basically putting all this pressure down. So you're kind of bearing down, pushing, trying to go to the bathroom. Well, that pressure, you're doing it over and over and over again. That pressure has to go somewhere, and oftentimes it's going to come out the front and split those muscles and create that diastasis. So it's really important, if you're having constipation issues, to try to minimize that and minimize the amount of straining that's happening. So the other cause of diastasis that I'll talk about is if you're overweight, or kind of on the flip side of that, you have a lot of tone in the muscles. So if you are overweight, you have more pressure inside of the trunk, just from the amount of weight kind of pushing on it. So they've found overweight to be a risk factor because it's just putting more pressure on those structures. On the flip side, like I said, having a lot of definition. So think of like your bodybuilder that's super ripped, you know, 6-pack abs. You can see like every ab muscle possible. That tension on them to make those muscles so defined, it can start to pull apart down this middle because there's just so much tension, and the muscles are just really pulling. So that's why we'll tend to see these issues sometimes with bodybuilders, because of the amount of tone they have. So if you are wondering, do we have questions at all we need to answer? Okay. So if you're wondering, how do you know if you have a diastasis, or how do you test this? There's so much information out there on the internet on what diastasis is, how to look for it, what to do. I think a lot of times people just feel really confused. They come into my office and they say, I just don't even know where to start anymore, or I've tried checking at home, I have no idea. It's much harder to check yourself for it, especially if you're not really sure what you're feeling. But so, you know, it is difficult. I will give you that it's hard to check yourself. One of the bonus materials that we'll send out after this will be kind of a step-by-step guide on how to check yourself, how to know if you have it, with pictures so you can kind of follow along. I'll kind of talk you through it right now, but if you want those bonus materials, make sure that you click that link in the video description to download the worksheet, and then we'll send you those bonus materials afterwards. So when you're going to check, you want to do is lying down with your knees bent up, and then you're going to take your fingers and kind of start at your belly button. You're going to put those fingers right into the belly button and lift head and shoulders up off of the ground, kind of like you're doing a crunch. And you're going to hold it there, and you want to feel for any separation. So what you should feel is kind of this really nice, like springy feel behind your fingers. If it feels like your fingers just sink all the way in and they just kind of keep going, that's an indicator of diastasis, because there's not that connective tissue, that fascia behind your fingers that you're pushing into. You also might feel the edge of the muscle. So you should, if you have a diastasis, you should be able to feel the kind of the edges of the muscle on the sides of your fingers. So you want to kind of gauge how big that gap is. So it might only be one finger. You can barely get your finger there, and you feel kind of the edges of the muscles on the side. They consider a diastasis recti to be about a 2-finger width. Anything 2-finger width or greater would be a diastasis. If it's less than that, like maybe 1 finger, then we just call it an abdominal separation. Sometimes you can get pretty significant gaps. So you want to check at the belly button, but then you also want to check above it and below it. So typically I say about maybe 2 inches above and below. you're going to do that same technique to feel, because the separation can happen anywhere between pubic bone and your sternum. So your belly button might be fine, it might be higher up, or vice versa. So you want to kind of check that whole length of it to see. So if you want pictures at all, like I said, download that link and then you'll get more images on how to feel. So what happens if you have a diastasis? Any of you already know that you have a diastasis and you are looking for tips on how to fix it, how to make it better? Raise your hand if you are already dealing with this issue. So I can give you a few seconds, like please comment if you're dealing with this so we know. If you're out there watching, kind of take a look. So awesome, thank you, way to go. So how many of you are currently pregnant and worried that you might get a diastasis and you want to prevent it? So if you're in that boat, give me a thumbs up on that. Maybe a couple of you. Okay, so we kind of have a little bit of both going on. So it's obviously better if you can try to be preventative and prevent it happening. You can, unfortunately do all the right things and still might have a small separation. It can happen. But the big thing is, trying to minimize it as much as possible. If you've already gone through it, you already have it, we can't go back in time. It's happened and that's fine. The big goal is not letting it get worse. So over time, you don't want that gap to start getting bigger and bigger and bigger. You want really to try to minimize it as much as possible, and then also really start to stabilize so that you are strong and stable in the core and the trunk. So when you're doing activities, you don't end up with issues like back pain. Because when you lose this support here on the front, now the back has to do all the extra work. So that's kind of the process, if you will. So what are we going to do? So the tips I'm going to go over right now are really can be used at any point. So if you don't have one and you're trying to prevent it, and if you already have one and you're trying to fix it and prevent it from getting worse. So these tips are good for anyone, on either end of that spectrum. So the first thing is making sure you're not holding your breath, that you're breathing. So that's probably going to be the easiest homework that you ever get, is to just breathe. But why that's so important is because when you hold your breath, you increase pressure. So think back to the Olympics when they've got Olympic weightlifting. And what do? They hold their breath, take a deep breath, hold it, lift, and then probably throw their weights down, make some crazy noises, whatever. But what you don't want to do, say you're just picking your kids up off the floor. Oftentimes we hold our breath when we're about to do something hard because it helps us do it, or at least we think it helps us do that task. However, not only are you holding your breath and it's increasing pressure, because remember, your water bottle is a set amount. It can't all of a sudden expand. So that pressure has to go somewhere. Then now you're trying to do a task like pick something up, which increases pressure even more. So it's really important that you're breathing. When you go to pick up your kids, exhale. Take a breath, pick them up, and exhale as you're doing that task. If you're exercising, making sure that you're breathing while you're exercising is also super important, because the more you hold your breath, the more pressure is building. And when you do things over and over again, that's when it becomes problematic. So breathing, super important. So that's number one. Number two is really starting with basic core exercises. So one of the things that we always teach is TA contraction. So think back to that deep ab muscle that I talked about, the transverse abdominis. We're going to call it TA for short. Because that's the main stabilizer of the trunk, that's the muscle that we want to target a lot of times, because it cinches everything in and it stabilizes rib cage, spine, pelvis. Without that working, you're kind of floppy, your body can do whatever because it's not stabilizing. So trying to activate it is good all the way through pregnancy and postpartum. You can pretty much do this whenever. You can't hurt anything by doing it. So we also have pictures in the bonus materials on how to do this with a little more instruction. But what you're thinking about is kind of drawing this belly button in, like you're trying to zip up tight pants. So you're not sucking it in and trying to hold it in. You're literally just drawing in, trying to pull this down in, and you should still be able to talk and breathe the whole time you're doing it. If you can't, then all you're doing is sucking it in, holding your breath. So it's just a drawing in, like you're zipping up tight pants. You can kind of feel on the front of your pelvis, like those little bony bumps on the front. If you feel right there and you try to pull that belly button in, you should feel it tighten a little bit under your fingertips. That's the TA muscle. So that's how you activate it. It's oftentimes really hard to do when you're pregnant, and then especially postpartum. So that muscle is, because it wraps horizontally, when you're pregnant, belly is expanding, this muscle is getting stretched. And so when a muscle is stretched and really lengthened, it's really hard for it to contract. It just literally can't pull together as easily. So you might notice that the more further along you get in pregnancy, the harder it is for you to do something like this. So I can say personally for myself, when I was pregnant, I did exercises that worked on this all the way through pregnancy, and it's really surprising how difficult it gets at the end. Even though I've been doing them, for 7-8 months before, it gets harder and harder and harder. So if you aren't doing that, or you're not using the right muscles, what happens is the muscle gets stretched and it shuts off. It kind of stops working because it's so hard for it to actually contract that it just says, it's better off I just don't even try. What happens when the muscle shuts down, now you have the baby, now you're postpartum, the muscle doesn't just automatically kick back on all of a sudden. You have to retrain that muscle to work properly. So I found this really interesting. I started doing some of the TA exercises when I was about like a week to 2 weeks postpartum, just really gentle, just trying to contract it. And it's crazy how difficult it is, even though I did it all the way 9 months of pregnancy. So even though you might be doing these things, it's postpartum is a completely different period. So just trying to draw that belly button in and kind of hold it is something that is safe enough to do right away postpartum. You don't need to wait till that 6-week checkup to get cleared for exercise to just do some of these really gentle tightening exercises. So it's really important that you start there at the basics, so that you start to train that muscle to work again. Oftentimes what I see is women wait 6 weeks postpartum, they get cleared for exercise, and then they go and kind of jump back into what they were doing prior to pregnancy. So maybe they ramp up for a week or two, but then they're back into like running or weightlifting or doing like P90X or whatever it is. And that core muscle hasn't been trained to come back on. And so they oftentimes end up getting injured or having problems because they haven't started at the basic level and worked their way up. So starting basic and then building from there and progressing is really the best way. And it's also the best way to try to prevent anything. And I'll just add to it too. When you are working that TA muscle and it's cinching in like a corset, that's also going to help heal your diastasis. It's going to help kind of draw things together a little bit. So if you already have one, that can kind of help bring those muscles together to some degree. Another big one is, especially if you're getting back into exercise, we're not doing crunches. No more crunches, ladies. It's just not a great exercise, like ever. So when you're crunching, all you're doing is you're basically folding and you're just increasing abdominal pressure. Well, as we've talked about, increasing abdominal pressure, it has to go somewhere, so it's gonna come forward and cause a diastasis recti. So if you're, don't have one and you're doing crunches, that puts you at a higher risk to get one. If you already have one, doing crunches is only going to make things worse. So if you're doing crunches, stop doing them, and we need to start at basic exercises and work up to something else. But we're not doing crunches because they're never going to be a great exercise. Plus, they're kind of inefficient. You're just working these superficial muscles. You're going to get more bang for your buck with other exercises too. We did have a question about if you don't have diastasis recti, like how do you know when is the right time to kind of jump back into normal ab exercises? And I will say, regardless of if you have a diastasis or not, if you're postpartum, I would start basic with everybody. So training that TA muscle to work and then building from there. So, I'll have people start with just that tightening at, shortly after postpartum, and then really waiting till you're 6 weeks and everything is well healed before trying to do anything more difficult. But I always start basic and work my way up to something that would be considered a high level, like planks or side planks. My opinion on it is if you aren't doing those basic exercises and you go back into like planks, side planks, etc., you're really not getting as much out of the exercise anyways, because you're not working the deeper muscles that you would really want to work. So whenever it's okay to resume it really depends on how well you can do those basic exercises. Kind of depends on the person. So hopefully that answered your question about that. And feel free, if you guys have questions, put them in the comments and I'll try to get to them. I'm going to answer anything else at the end. So the other tip is making sure you're drinking a lot of water. So being well hydrated is really important because then all of your muscles are hydrated and your muscles need water in order to work. So you can't strengthen your core muscles if you're dehydrated because the muscles aren't going to contract like they should. So really important if you want to strengthen muscle. It also is important because if you're dehydrated, that can lead to constipation issues. Sometimes if you're dehydrated, you also might have more pelvic floor issues. So with both of those, you could be straining to go to the bathroom, which is putting more pressure on that diastasis. and making things worse. So making sure you're drinking enough water. The recommendation is kind of like 8-ounce glasses of water in a day. So about 64 ounces, that's about half a gallon. So drink your water and breathe. Some really easy homework. And then lastly, the biggest tip I can give for diastasis is to see a physical therapist. And I would recommend seeing a pelvic floor physical therapist, not just any old PT, because we are really specialized on looking at all of these different structures and fixing all aspects of it. So as I mentioned earlier, everything is so connected with all of the fascia, that deep core muscle along with the pelvic floor muscle, and also how the diaphragm is moving, how the pelvis is moving. It's all connected. And so if you really want to help heal that diastasis, not let it get worse, you want to bring things together, and you really want to set yourself up for long-term success with this, the biggest thing really is see a PT. They can assess you and let you know if you have one, how bad is it, and then what can you do to fix this. So for any of those that are watching this, if you're interested and you're in the Milwaukee area, shoot us a message or give us a call, and I'd be happy to do a free consultation to kind of look at these issues and let you know what is it going to take to fix this and resolve, so that you can go play with your kids, push a stroller, get back to exercise, and do all of these things without having pain, without feeling unstable, like your guts are going to fall out, or maybe you really just want to get rid of that mommy tummy. They're all kind of connected. So if you're interested in that, please get in touch with me, and I'd be happy to help you and take a look at that. So I hope that answered a lot of your questions, and gave you a couple things that you can implement right away at home, kind of get yourself going to prevent it or heal it, depending where you're at right now. But yeah, does anyone have any questions? Anything that you want me to talk a little bit more about, or that I didn't cover well enough? Kind of give you a chance if you've got questions at all. If you do, you can always put them in the comments afterwards, and we can answer them also, or send us a Facebook message and we'd be happy to answer them. If you want to get in touch with us, you can call our office. It's at 414-331-2323. Or you can also email us. It's brenda@revitalize-pt.com. So those are kind of different ways you can get in touch with us. We also check our Facebook messages. So whatever is easier for you, that would be great. And like I said, if you have questions, feel free, reach out. I'd be happy to answer them and happy to talk. So hopefully that this was really helpful for you. Hopefully that this gives you a little more answers and helps clear up some of that information that's out there. I think there's just a lot of different things out there, and I think a lot of times people get confused. So, all right. Well, thanks so much for watching and coming, and like I said, get in touch with me if you have questions. Have a great day, everyone.